This is a BT video looking at the topic organisation, and we're looking at coronary heart disease, cardiovascular disease, what can go wrong with the heart and what we can do to fix those problems. So cardiovascular disease is a general term used to describe any condition that affects the heart or blood vessels, usually associated with a buildup of fatty deposits inside the arteries from poor diet or from smoking. Also associated with damage to arteries in organs such as the brain, the heart, the kidneys and the eyes. So here is another picture from Body Worlds. This is showing the coronary arteries. Okay, there's three main arteries that feed the heart, okay, and they're called the coronary arteries. Okay, so coronary heart disease is disease of these arteries. Okay, so you can see those three main arteries coming out of the heart there, and then kind of separating off into smaller capillaries. So the coronary arteries supply the heart with its own supply of oxygen and nutrients, glucose for respiration. When they narrow or become hardened, it can stop the blood from flowing through those arteries, and if the blood doesn't flow through, the oxygen doesn't flow through, and the cells that need the oxygen for respiration don't get the oxygen that they need, and this can lead to coronary heart disease. Okay, it can be chest pain, angina, or lead to a full-blown heart attack. So here is a picture of just a section of the one coronary artery here, and you can see this rectangle here is blown up here so we can see it better, and there's this fatty deposit, this plaque build up in the artery, which is stopping blood from flowing through that artery, so therefore stopping the oxygen getting to these cells below. And you can see this whole area of the heart, these cells have died where they haven't been fed with oxygen, they can no longer respire. Okay, so this elastic muscle is then starting to die. It's weakening the whole heart muscle as a whole, putting more strain on it, and that can lead to the heart attack. Okay, so it's about the fact that it's reducing the blood flow, therefore reducing the amount of oxygen going to the cells. And we can see this narrowing of this artery because there's been this build-up of fatty deposits. Now, this can be from our saturated fats, okay, having too many animal fats, fat on bacon, fat on steak, processed food, burgers, all of those sorts of things, okay? Or it can be from the deposit can be built up from smoking, okay? So basically poor lifestyle in the sense of diet and smoking can cause this effect. So here is what's called smoker's leg. Okay, so the arteries in the leg have built up with so much plaque, they've become really clogged, and so the cells aren't getting the oxygen that they need, and it can lead to amputation of the leg. Okay, just to show you how serious it can become. So what can we do to fix this? Okay, we could go for minor surgery using stents. Okay, and you can see from this picture on the right hand side that a stent is a very, very, very small, it's a smart alloy, okay, which you learn about in chemistry, and it's basically this small kind of mesh balloon, straw that's inflated using a balloon. Okay, so that is fed in through the artery. When in position, it's inflated using a balloon, and it sticks all of that fatty deposit, the plaque, to the sides of the wall of the artery. Okay, if we just try to scrape out those bits, they could go to the brain, in which case that would be really bad news. So it's better just to leave it in place and just reopen the artery using one of these stents. Okay, it can stay in there forever. It's flexible, it's strong. Like I said, it starts off with this very narrow tube, and then it's put in position, inflated using a balloon. Okay, I imagine that they can't overinflate it because the balloon will only inflate so far, just to get it to exactly the right expanded shape of that blood vessel. Okay, to reopen up, allow the blood to flow again. Okay, so we've got instant relief from this. Okay, it's instantly opening that blood vessel to allow the blood to flow again and for oxygen to get to the cells. So that's a stent. Okay, fairly minor surgery compared to replacing the heart. Okay, or we can go to the doctors, and the doctor can give us drugs called statins. And what statins do is they start to break down those fatty deposits. Okay, so it's kind of like having a quick fix, like a kick start to the doctor saying, right, okay, improve your diet, stop smoking, stop eating the saturated fat, the fat that can cause these blockages, and the statins will help to clear away the damage you've already done, but you're on those just while you're sorting out your diet. Okay, because long-term use of statins can result in liver damage, and people tend to rely on this. Oh, I can have whatever I want to eat because I've got my statins. They're going to fix all of the issues of the food I'm eating. Okay, but it's not really the case. If someone's a lot older, then fine, put them on statins, keep them on statins, not too much of a problem. But if someone's a bit younger, it really is just a temporary measure just to help them while they're sorting out changing their lifestyle. Okay, so stents and statins can help unblock those coronary arteries, any of those fatty deposits that we may find in the arteries. Okay, so imagine we're in a situation now where the heart is so damaged we need a new heart. Okay, we can have what's called an artificial heart. This is a mechanical heart. It's made of plastic. Okay, and although they tend to say that they have a short usage, actually they're being used for longer and longer now. Maybe even a year somebody could survive with one of these artificial hearts. So it replicates the function of the heart. Sometimes they can clot the blood because it's plastic and everything's it's not as flexible. When the red blood cells go through, they kind of get knocked and damaged, and it causes some clotting there. But if you're on the waiting list for a biological donor and your heart is not doing the job it's supposed to do, then this is a brilliant kind of short-term fix to keep you alive while you're waiting for that donor. Okay, so the mechanical heart. Some people say they can actually hear the valves opening and closing in their heart, inside their chest. But to be honest, I think if it's keeping you alive, it's a really great technological advancement. So this is the heart donor. Okay, so someone's died and they've donated their heart to somebody else, and this is really good at replacing the heart rather than having a mechanical heart, because it's appropriate for the person. We've got to be careful with rejection of an organ. Okay, just like pathogens, organs have antigens on them. Okay, bits of protein that are kind of like markers that the body can recognize. And with someone else's heart going into you, it's got antigens that your body doesn't recognize. So therefore your white blood cells start trying to produce antibodies to attach to those antigens, which we call rejecting the organ. So people who have a heart transplant end up on immunosuppressant drugs, which suppress the immune system so that the white blood cells don't try and fight and reject the heart. The problem with that is that it lowers your whole immune system, so therefore you can get ill quite easily. So let's look at the advantages and disadvantages. Imagine this is kind of a 4-mark exam question. So the mechanical device is the artificial man-made heart made of plastic, and it replicates the function of the heart. The advantage, it's a good short-term measure to keep patients alive while they're waiting for a biological donor. Disadvantages, that the designs have not been very successful. They're prone to blood clotting, and people can hear the valves moving. Transplant, or it could be a heart transplant, it could be a heart and lung transplant, and it's where a recently deceased donor has donated their organs. It will give a much better quality of life, but there is a low availability of organs, so you're on a waiting list. Your body can reject them, we just talked about that, so you take the immunosuppressant drugs, which then reduce your immune system. Okay, so there's quite a few disadvantages there, but it is going to provide a much better quality of life. We can also go for animal organs. Okay, so sometimes cow valves are used. We'll talk about valves in a second, but also pig hearts, and pig hearts have been successfully used for transplant, so there's better availability of them. Okay, faulty valves. Sometimes it's not the heart is good enough that it's just the valves that need replacing. So there's no point replacing the entire heart, just replace the valves. Now those valves are not going to come from a good heart, because if there is a good heart being donated, then they're going to use that for someone who needs a whole heart. But we could just replace the valves in using a biological source, probably from an animal, or a mechanical source, which is a man-made valve, and there's a man-made valve in this picture here. So sometimes those valves become stiff or they leak, which prevents the valves from functioning properly, prevents the backflow of the blood, so the blood is kind of sloshing around all over the place, and it's possible to replace those valves, like I said, either with a biological source or a mechanical valve. So, advantages of the biological valves. They don't damage the red blood cells as they pass through, so we don't get the blood clotting. They can harden over several years, so they'd have to be replaced again. For patients with long life expectancy, so younger patients, there is a higher chance that they will have to have further operations to replace those valves. Mechanical valves are strong and durable. They last a lifetime, but they can cause damage to the red blood cells and those clots as they pass through the open valves. You have to take anti-blood clotting drugs for the rest of your life to thin the blood so that it's less likely to clot, and some people say they can hear the valves opening and closing. Okay. Hope you found that useful. Thank you.